So come on and stand here. All right. So you just take a couple steps in place, like a basic, I'm sure she's studying to be an occupational therapist, so she knows the drill. And you know, if you look down at your feet, you can see how this foot's winged out a little bit, right? Because everybody has one side of their pelvis is going back and the other side compensates by going forward.
Right. It's definitely.
No, this is forward.
Yeah.
Okay. Now this, to get rid of this, you have to put a fulcrum up higher here. Then, you know, here's a classic exam. You know, we come back here, and what you're going to do is you're going to raise one knee up and then the other.
Okay.
So first this side. Good, and down, and up, and down. Okay, she's fixated on the left. Go ahead. Right knee, yep, moves perfectly, and jammed. Okay.
That's funny because I think that's what I had been told previously, that it's a little...
It should drop.
Like different on my left side.
Okay, put two hands here.
Okay.
Now, right leg up.
Okay.
Do you see how that side just doesn't glide? And you have to train yourself to look for that. You'll notice that this side drops.
Gotcha.
Watch this side. This is my good side.
Okay.
Okay. Here.
Okay.
Versus here.
Yes. Okay. Now that you put it back. Yeah.
Okay. And so that means how I'm going to adjust it.
Okay.
You don't want to crack it or adjust it into the subluxation. Ooh.
I mean, I know you've done it so many times.
Thousands of times. So that's why everybody's slightly different. Like, not everybody has that on the front here. So she's on the left-hand side. She's here, Linnea. Let's just show real quick what I'm trying to do here. So I've been working on it for about 10 minutes, 10, 15 minutes, and I finally figured out which way she's going. So right here at the bottom of the occiput, she's got a problem right here. And then when we switch, like, remember I said your head was tilted to this way? And I said, well, I wonder why. So you're tilted this way because your SEM is real tight over here, which is unusual. It's usually the SEM's tight on the left. And then I felt this little congestion. She doesn't have it back here on the occiput like she has on the left. She has it anterior towards it, right here, into this mastoid.
I was going to say, that's where that attaches, so that...
Yeah. So you got to work on this.
Yeah. Ooh, yeah, I do.
That's all right. Yeah, most people, they have a tight atlas and a tight SEM on this side, but this side, nothing.
Wow.
Nothing here. See, you're going to figure it out. You'll figure it out yourself. Most physicians, we kind of, it's so hard to be objective about your own body.
Yeah. Well, and also, you know, like, the training, and you can take both sides of my neck, and you can, feel everything, whereas I can be like, oh, well, I can poke around.
Okay, you ready? It's ready.
I'm ready.
Come up here. Very good. Oh, there goes already. Was that okay?
Yeah.
All right, here we go.
Woo! Yeah.
See, you hear that? That's high in the neck. The little pops are lower. Right here. Okay, that's all it's going to go on that side. I'm just getting the upper neck.
Ooh.
You're clunky. Okay, I think that's all it is. There's more in there, but you're not ready for it yet. Once you desensitize the nerves, it's not as bad. All right, you ready for your toes? No broken toes, no broken feet.
No.
Imagine taking a history on, like, an 80-year-old person.
Right.
It's like, we need a whole hour for this conversation. Okay, this is proprioception.
Yeah.
Above, down, inside, out. Oh, okay, so I kind of go, this toe isn't as mobile. That's that foot that was winged out, and it rolls in. So a lot of pressure on this toe.
So interesting.
See if I can grab a hold of it. There it goes. There it goes. The baby. Okay, reach overhead and grab the table. Good. Ooh, a little bit of tightness on this side. See that? Not as bad on this side.
Whenever I try to do, like, some hip stretches, I can always tell my left side is
Tighter. Okay, really grab on.
holding on.
You have so much strength. Look at you. Wow. Yeah, it's just tighter on this side. So, I mean, I think we've confirmed it. Okay?
Yeah.
We're all... I have have some theories of why it's 80% like that. I think it's because the heart is on the left-hand side, and since we were embryos, we grew around the heart.
Oh.
It's huge. On an embryo, it's like half the body.
Right.
And it beats from, what, 6 weeks?
Mm-hmm.
So the body just curls around the heart. So the shoulder will come up, and then the hip compensates. This is a pretty ring.
Oh, thanks. That's
An emerald.
yeah.
Is that your birth? Oh, I missed the crack. Sorry, guys. All right, so we're gonna go face down on your stomach. Here we go. And then hands go on the pads. Perfect.
Oh, this is nice.
You're like, I'll just stay here and fall asleep. And we were thinking about building like a little world underneath the table for people to watch while they're there. It's like a hole, you know, that people look through.
Yeah.
Put like a little carnival in there. I don't know. Okay, so here we go with this. Now she's saying she's been having some symptoms here.
Yeah.
I'm just going to lift it to there. There you go. And she's been having some inner thigh pain on the left.
Mm-hmm.
Or you're saying it's not pain, it's just...
It's pain.
Oh, okay, it is pain.
It's like not all the time, but it's pretty sensitive. Like superficially it's sensitive, but
okay,
it's got its behaviors.
And that's kind of odd. It's an odd place to have symptoms because it is like, right, the inner thigh is, you know, higher up in the lumbar spine. L1, L2, L3.
Mm-hmm.
This feels good. I'm going to hold down the sacrum, and you're going to lift this leg up straight as high as you can.
Okay.
Straight back. Yep.
Like this?
Yep. Just like that. And then down. And the other leg. And down. Interesting. Interesting. Yep. This is definitely your anterior rotated side, and this is the posterior right here. You can see the seam of the pants. Watch people's pants, their seams.
Oh.
Yours is shifted over towards the right, in line with an anteriorly rotated pelvis. Oh. And I used to think that it was always the pants that were made wrong. And then I was like, oh, no, that's just my body. It's twisted.
The left is a little, it's a little tender. Like
when I press?
Yeah, not badly at all, but I can feel...
Well, does it kind of feel good to come this way versus this way?
Yeah.
Right? It kind of feels good to correct it.
Uh-huh.
So this is actually, well, I'm exaggerating. This is actually neutral for you. You okay in there? Do you want to scoot up?
No, I'm good.
Okay.
I'm fine.
Your chin isn't hitting anything?
Nope.
Okay, here we go.
Woo! That's ticklish.
I'm sorry.
No, it's okay. I didn't expect it to tickle so much.
Okay. She might not be a good candidate for the green roller. But up here it feels okay, right?
Yeah, no pain at all.
Right. Good. Well, your problem's not there. It isn't until here. Right there. Now I feel it right there on the left. Breathe. Expand that rib cage. Okay, when we get into this lower thoracic area, I like to go with the plane of the joints. So we're going to go here like that. Breathe. Yep, and out. Am I bruising you? Not too badly. I'm just going to this way. Can you handle a little bit more?
Yeah, whatever you need to do.
Okay,
that's fine.
Here we go. Ugh. I mean, I can't even stay on it.
It's funny that it feels ticklish on that side, like
even now.
And it's not really much anymore, but
okay. Remember your anatomy.
Mm-hmm.
What nerve endings are for tickling and for the sensation of pain? Are they the same or are they different?
Pain, temperature, and light touch, I think, are one.
Mm-hmm.
And then, like, vibration, sense, and crude touch are the other.
Very good. Well, the serve one, the same one, which is pain perception.
That's a tickling one?
Nociception, right? That is the same one as tickling.
Oh.
So when you feel that tickling sensation, that's actually the predecessor to pain.
Oh, okay, that's interesting. I definitely feel something on that side, like, different than on my right side. So that's interesting.
Now there's a compensation on this side, which is interesting. How far up does it go? I haven't even cracked you yet.
It's like an adventure.
It's like an adventure, that's right. It's like a box of chocolates. Yeah. Very good. I think you're ready for the adjustment.
Okay.
We're going to do that. Okay. Got this left high shoulder. Deep breath in. All the way out. Perfect. Again. Uh-oh. Deep breath in again. Perfect. Now here's this one that's just, I don't know if it wants to go. Any pressure, any pain, you're okay?
No.
Yeah, that one's going to be a hard one to get, and I'm not going to force it. Now, for this one, I might still need to work a little bit harder on it, but I'm going to reach in the front on this hip bone.
Okay.
The ASIS. Breathe. Does that feel awkward, or does it feel okay?
No, it's fine.
Okay, here you go. That's the one you got to work on, okay?
Okay.
Ugh. If I go harder, I know you feel it more acutely.
It's definitely bearable though, like it's alright.
Okay, when we first started, it was like, wah!
Yeah.
I think once you get rid of all those proprioception,
yeah.
bendings, and you get past that, you can handle a little bit more. Yeah, I'm just trying to drain this mid-back. Just put some paper towel to protect your clothing. Let's see what I find over here.
Okay.
This is the SI joint. Sometimes if you bend somebody's knee, you can get a little bit more of a better idea of how it's moving. And then down. It's on the side here. This is more of the lateral aspect of the leg. This nerve here goes down the lateral side.
Mm-hmm.
Nothing sharp into the leg.
It's not sharp into the leg. It's
just right here.
Yeah, exactly.
Okay, I'm gonna have to use a roller on it because it's pretty far south here.
Okay.
Nerve entrapments, happen here. And then I'll watch. That's why I have the shirt up. I'll watch to see if it's influencing up here.
I think it's the way that I sit, or that I used to sit most of the time, and I can
definitely make it worse.
I kind of took a look at it, and I was like, "Hold on, what are you doing?" Because I was all scrunched up and
you sitting on one foot.
Yeah, I would sit with my left leg. Normally with my right leg folded, either underneath me and my left leg up, and so I'm leaning.
I know.
Everything you're saying, I'm like, yeah, okay, that's probably not helping it.
You gotta kind of sit Indian style.
Yeah, so it's at least
somewhat
it's
even. Yeah. If you want to prop your feet up, and then as you lean forward, you're stretching your glutes. It doesn't engage the low back as much when you sit Indian style.
Okay.
Because you're forced to rock forward on your legs and stretch your glutes. Because you'll topple over if you use your low back.
Right.
So you end up stretching your glutes instead. So I tell women, I'm like, well, because the guys won't do it. But I'm like, when you're sitting in class, in lecture hall, cross your legs like you did in school.
And they won't mind. I'll say, hey, it's in the name of body mechanics.
I used to sit there. See, I got pregnant halfway through my second year.
Wow.
Or the end of the first year. And so everybody just kind of after that, it was, well, if Brenda's doing it, why not? I'm the one like, you see this big belly? I'm gonna sit any way I want.
Yeah. That must have been so hard, like doing all the schooling and everything. Yeah. Someone that in our class just had a little one, and I don't know how she does it.
Okay. So this is my little star here. And this will save my thumbs. It's just faster, more effective, quicker. And that's about done. And here's this one. Oh, here we go. I'm gonna go over here. Yep, you got it. You let me know if it's too much.
No, it's the spot.
Aww.
Especially when you can't see their face. You gotta...
I gotta keep asking
checking in with them.
Yes, I do. I have to. I'm like, are you okay? Okay.
Yeah.
Well, I watch for flinching, and
like bracing. Yeah.
Yes, I watch your hands here.
No, so it's really not bad. It's just that you found it. Is all.
So I'm gonna grab the muscle, kind of pull it up. There it goes. Hey, look at that. Very good. I'm gonna go lateral just to make sure. Oh, sorry. I kind of like use my pinky as a brace. So if it's not my thumb, it's my pinky. No, there's very little pressure on my pinky. Because you have to have control or you'll just slide off and hit a bone. So you come in here very carefully. There it goes. All right, it popped. Real sensitive nerve bundle is right here. You know, people, you gotta be careful there. Nope, not too much. Feels like there's a little pocket here. Very minimal bruising. You can still go to the beach this Saturday.
Well, it's the end of the term, so we got a lot going on, sadly.
Aww.
It's all good. It's fine. Go for it. Smash it out of there.
Get it, get it, get it.
So what is this?
Dude, this you can tell that it's scraping through those, like the top centimeter of adhesions.
Oh, that's what those are.
Yeah, like you have different layers, right? The tissue has different layers. The fascia has different layers. So this is its own layer. Whereas the red star that I was using, that was a deeper layer.
Okay.
That was like a good inch or two into the tissue. This is just the surface.
Gotcha.
And yeah, when there's an area of congestion, like right here, it just comes out and through the skin, you know? And you're like, oh no. But it's not going to hurt you. Just put some arnica on it. It'll go away in about 3 days, 2 to 4 days. Got a little problem here. Yeah, so even though this is your chief complaint right here, it's so deep here. So that's why I'm not pulling anything out with the scraper.
Gotcha.
It's too deep in here. She's got a little bit of TKA that came out with the green roller, but I mean, this is like a good 3 inches in there.
So, am I right?
Yeah, other side. Because you got to go both directions. It's like backing out a car. You can't just back out one way. You'll hit. You got to kind of finesse your way into place, both sides. So this side, come here, and you're gonna look back towards the wall. Protect your neck. All that work we did. Relax. There we go. Good. It's got a little bit more in it though. I didn't quite get it. There's more. Oh, breathe, breathe. There it is. I just really had to. All right, there we go. Here it is. Back. Good. I think that's it. There's one little piece here that I don't know if I got. There it is.
Ooh.
Yeah. I'm like, no, we didn't get the whole thing. Then bend both of your knees. This is just a good. This is a PT move or a BO move, maybe osteopathic move. So you're gonna press out against my arms. 1, 2, 3, 4, 5, and then squeeze, squeeze. There it goes, a little bit. This is for the pubic symphysis.
Yeah, if I can do this and I pull, then something cracks sometimes.
Oh.
I don't know when I found that out, but
Squeeze. You're strong. A little less, a little more. No, that's it. That's all I'm gonna get.
push. Ooh.
Good, good, good. Ears? You ever had your ears done?
No.
They get really warm afterwards. It goes away for about 30 minutes. They just kind of, there's auricular cartilage, and that's connected to the eustachian tubes. So if you're feeling like congested and everything from your allergies, just open that up, okay? Here we go. You're gonna lean away from me, lean more. Okay, we're gonna go this way, tilt. You're gonna tilt, yes, I gotta open it up. There it is, good. So crazy. You did good, you're doing good, yay. Almost done. Final spinal and it's on the ear. I'm too high, sorry. That's it, right there. Anyway, good.
Oh my gosh.
You need like a really tiny mic to like pick these up or something hidden. Because that thing can't get it. Ooh, see we got lupus adhesions here. It's okay. I'm not going to pull that hard, but you got to work on that right one.
Okay.
You just take your ear like this. Just grab the ear, and you're just going to pull out like this, and then up. Yeah. Right here. Yeah, see, there's still some restriction in there. If I don't get it today, I don't. Oh, right here. Relax here. There it goes.
Ooh.
I knew you had it. I'm like, she has it in her. Because I felt it. I didn't get that. Like, it's like a more closure for the joint. Here. There it is.
Wow.
So that was the next one. That's the deeper one.
Okay.
And then, is it touching that part, that rib?
Yeah, I think so.
Yeah, bend your knees. You gotta squish that fluid out. There you go. Right? How was it?
It was good.
Was it intense or was it not as bad as you thought it was?
I didn't think it was going to be bad, but you definitely got more than I realized I had in me, basically.
Oh, that's a good way to
like a deeper,
deeper level,
like up with the neck. And it's funny because sometimes if I'm doing something and I pull my head back up, like I'll feel like a little crick, like up here. So I'm glad that you were able to get those because now I feel like I'm.
I don't think that one ever got moved.
Oh.
That was like a new one.
Oh.
that was a different feeling. Like I can tell where you've been and where you've been adjusting yourself. Because those just kind of went.
They just haven't moved.
That was one that hadn't quite gone like that before.
Gotcha.
That's why it made that sound.
Yeah.
Very interesting. All right. We're done.